Welcome back to Thrani, I'm Joe B. Today I'll show you how to provide a thrust manipulation technique to fix pelvic upslip. Let's dive in. Pelvic or iliac upslip, also known as an iliac superior shear, is when the ilium gets stuck deviated superiorly. The cause of this can be due to repetitive jumping or landing on one leg, with interosseous ligamentous laxity resulting to the iliac upslip, along with hip adduction and lower extremity superior shift. There is also side sacral bending, but opposite lumbar side bending. Ilial or iliac upslip can bring about low back pain on one side and a feeling of tightness. The pain increases with repetitive jumping and landing on that leg where the pain is located. Furthermore, there is also a feeling of a leg length discrepancy. The assessment for iliac upslip requires the patient to do bridging first to balance the pelvis and then be in supine. The therapist should be on the dominant hand side, in this case the left hand side. The therapist's first dorsal web space of the hand should be placed at the iliac crest first to check symmetry. After that, the thumbs reach down to check the anterior superior iliac spine, or the ASIS, for symmetry as well. Finally, both web space go down to check for the greater trochanter symmetry. Normal findings is that all bony landmarks will be symmetric. Abnormal findings will be that the upslip side bony landmarks will be more superior than the patient's left side. In addition, there may also be ipsilateral or same side trunk side bending, or side bending towards the upslip side. To treat the iliac upslip, patient assumes a supine position with treated hip close to the edge of the table. The therapist will be on that treated side with hands grasping the leg above the malleolus. From there, the therapist abducts the hip by approximately 20 degrees and slightly internally rotates it. After that, the ilium is pulled by leaning backwards. Once the limit of the range is attained, or grade 4 mobilization, the patient is asked to huff or cough for counterforce, while the therapist simultaneously pulls the leg for a grade 5 manipulation, or what you call a high velocity, low amplitude thrust. The patient's hip is abducted 20 degrees and slightly internally rotated in order to focus the force on the ilium. Hip drop exercises can be provided for the patient to reduce or eliminate likelihood of iliac upslip. This is performed for 2 sets of 10 reps and eventually progressed by adding hold times. So do you want to know how to provide a non-thrust mobilization technique to fix pelvic downslip? If so, then watch this next video. Thank you so much.